Appetite suppressants help people lose weight by controlling hunger and making you feel full faster. But it's buyer beware. There are many supplements that are sold over the counter and online that are not FDA approved and can be completely ineffective, or even worse, have dangerous side effects. Appetite suppressants definitely have a place in weight loss, but they should be FDA approved and prescribed by a physician. Hello, I'm Dr. Tripti Patel, a board-certified obesity medicine physician and founder of Physicians Premier Weight and Wellness Center here in Virginia. I believe we have come a long way from some of the old weight loss medications that we had in the past. Many, such as fen-phen, were taken off the market due to adverse side effects. In fact, over the years, many of the weight loss medications have unfortunately gotten a bad reputation. Today, I'm going to talk about some appetite suppressants or weight loss medications that can safely and effectively be incorporated into a comprehensive weight loss program. These are medications that are FDA approved and have excellent safety data behind them. Keep in mind, though, that none of them are the magic pill when it comes to weight loss. By themselves, they are usually not very effective, but when combined with a really good eating plan, they can be extremely beneficial. Why? Because they decrease hunger and cravings, making it easier to follow a specific eating plan. I find that patients are often a little bit leery about incorporating weight loss medications into their program. Many people feel that if they take them, it is a sign of weakness. But in reality, this is absolutely false. It's not weakness, but rather it's physiology. Weight loss struggle is real. It's not just due to lack of commitment or effort. When you're feeling hungry and craving something, you are up against a number of powerful hunger hormones that cause you to overeat. So let's talk about a couple of specific weight loss medications that are often prescribed. The first one is phentermine. Many people have heard of this medication. It is probably the most popular appetite suppressant worldwide. It was FDA approved in 1959 as an appetite suppressant. It decreases your hunger and makes you feel full faster. This medication is a mild stimulant and is therefore a controlled substance. But when taken under a physician's care, it can be a beneficial addition to your weight loss program. Another newer weight loss medication is Contrave. It was FDA approved in 2014. Like phentermine, it reduces hunger and makes you feel full faster. But it also significantly helps control cravings and temptations. It helps you take your focus off food. Contrave is a combination of two very old medications, Wellbutrin, an antidepressant, and naltrexone, a medication used to reverse opioid overdoses. There are a handful of other FDA-approved appetite suppressants that are used, and there are many more that are currently being studied. Look out for many safe and effective options to come out in the near future. If you have questions or desire a customized weight loss plan in a supportive environment, please reach out to us at healthymeweightloss.com. My team and I are skilled and ready to help you meet or exceed your weight loss goal.